Topic ICD 11 questions. Question number 1. In ICD 11, which of the following groupings includes a dimensional element for the diagnosis within it? A. Dissociative disorders. B. Schizophrenia and other primary psychotic disorders. C. Disorders due to substance use and addictive behaviors. D. Anxiety and fear related disorders. E. Catatonia. There are categorical and dimensional approaches to diagnosis. In terms of categorical approach, list of characteristic symptoms is provided for each diagnosis. Presence of a number of symptoms from the list is sufficient for making a diagnosis. In dimensional approach, severity of a symptom or the degree of a disturbance of a specific psychological function is rated on a quantitative dimension. Personality disorders, schizophrenia and other primary psychotic disorders, and depressive episodes in mood disorders each include significant dimensional elements to enable clearer descriptions of the symptomatology experienced by patients according to ICD 11. In schizophrenia and other primary psychotic disorders, this includes positive symptoms, negative symptoms, depressive mood symptoms, manic mood symptoms, psychomotor symptoms, and cognitive symptoms. In terms of question number 1, the answer is B. Schizophrenia and other primary psychotic disorders includes a dimensional element for the diagnosis within it. Question number 2. Which of the following is a new mental health disorder under ICD 11? A. Prolonged grief disorder. B. Trichotillomania. C. Sadomasochistic disorder. D. Hyperkinetic disorder. E. Acute stress reaction. There are a list of new diagnostic categories in ICD 11. Prolonged grief disorder is one among them. Prolonged grief disorder is a new mental health disorder under ICD 11, categorized under disorders specifically associated with stress. It describes a persistent and disabling grief reaction which lasts longer than 6 months and is out of keeping with what is expected for the cultural context. Trichotillomania was in ICD 10, as was hyperkinetic disorder, which has now been recategorized as attention deficit hyperactivity disorder. Sadomasochism and other consensual sexual practices are no longer generally considered to be pathological. Acute stress reaction is no longer seen as a mental health condition but as a normal reaction to extreme stress. It is categorized under factors influencing health status or contact with health services. Therefore, the answer for question number 2 is A. Prolonged grief disorder is a new mental health disorder under ICD 11. Question number 3. Which of the following is one of the maladaptive traits that can be used to further describe a diagnosis of personality disorder in ICD 11? A. Impulsivity. B. Mood variability. C. Affective lability. D. Dissociality. E. Anxiousness. Let's look into ICD 11 dimensional revision of diagnosis for personality disorder. So according to ICD 11, there is single personality disorder diagnosis. It is characterized by problems in functioning of aspects of the self and or interpersonal dysfunction. According to the severity, it is graded as mild, moderate or severe. The optional specifiers or maladaptive traits that can be used further to describe a diagnosis includes negative affectivity, detachment, dissociality, disinhibition, anancastia. A further qualifier of borderline pattern can also be used. The answer for question number 3 is dissociality. This is one of the maladaptive traits that can be used to further describe a diagnosis of personality disorder in ICD-11. Question number 4. Which of the following concepts is reflective of a change in ICD-11? A. All disorders can be diagnosed at any age. B. Cultural considerations have been removed. C. Introduction of gender incongruence as a mental health disorder. D. Removal of minimum symptom count for all disorders. E. Use of dimensional approach for all disorders. ICD-11 takes a lifespan approach to diagnosis, permitting diagnoses which were usually associated with childhood or adolescence, such as attachment or conduct disorder, to be diagnosed at any age. It specifically considers the cultural background of a patient in diagnosis. A dimensional approach has been taken in personality and primary psychotic disorders, as well as for depressive episodes in mood disorders. Minimum symptom counts have been removed from diagnostic criteria for most disorders, but not major depression. Gender incongruence, replacing gender identity disorder, has been moved to the sexual health chapter of ICD-11 as it is not a mental health disorder. One more important change is there is no separate disorder grouping for mental and behavioral disorders with onset during childhood and adolescence. Question number 4. The correct answer is option A. All disorders can be diagnosed at any age. This concept is reflective of a change in ICD-11. Question number 5. How many groupings of diagnosis are there in the new ICD-11 chapter on mental, behavioral and neurodevelopmental disorders? A. 10, B. 11, C. 18, D. 21, E. 26. There are 21 groupings in the ICD-11 chapter focusing on mental health disorders, which uses an alphanumeric ordering system. They are listed in this slide. The answer for question number 5 is 21. There are 21 groupings of diagnosis in the new ICD-11 chapter on mental, behavioral and neurodevelopmental disorders. Question number 6. Which of the following is a new disorder ICD-11 found under the obsessive compulsive and related disorders diagnostic grouping? A. Complex post-traumatic stress disorder. B. Compulsive sexual behavior disorder. C. Hypochondriasis. D. Gaming disorder. E. Excoriation disorder. Excoriation disorder is a new diagnosis under the obsessive compulsive and related disorders diagnostic grouping. It is characterized by repetitive picking at the skin leading to lesions. It is accompanied by unsuccessful attempts to decrease or stop the behavior. Most commonly, the picked sites are face, arms and hands. Skin picking may occur in brief episodes, scattered throughout the body, or in less frequent but more sustained periods. Complex post-traumatic stress disorder is a new disorder under the disorders specifically related to stress grouping. Compulsive sexual behavior disorder is a new disorder under disorders of impulse control. Hypochondriasis was already an established diagnosis in ICD-10. Gaming disorder is a new disorder under disorders due to substance use and addictive behaviors. The correct answer for question number 6 is option E. Excoriation disorder is a new disorder in ICD-11 found under the obsessive compulsive and related disorders diagnostic grouping. Question number 7. Which of the following is a change in the diagnostic criteria for anorexia nervosa in ICD-11? A. Endocrine disturbance is not necessary for diagnosis. B. Threshold BMI for diagnosis is now 18 mg per meter square. C. Fat phobia is necessary for diagnosis. D. Specific behaviors for weight loss is not mentioned. E. Cross-listed with obsessive compulsive and related disorders. In terms of change in the diagnostic criteria for anorexia nervosa, endocrine disturbance is no longer necessary. A significant proportion of diagnosis of atypical anorexia nervosa were patients who met the other criteria for the full disorder but did not yet have endocrine disturbance. So this change is intended to eliminate this issue. The threshold BMI has been raised from 17.5 to 18.5 kg per meter square. Qualifiers are used in ICD-11 to describe the behaviors associated with the diagnosis, such as restriction and binging and purging. The answer for question number 7 is option A. Endocrine disturbance is not necessary for diagnosis, which is a change in the diagnostic criteria for anorexia nervosa in ICD-11. Question number 8. The core concept of the paraphilic disorders in ICD-11 is that they involve sexual arousal that focuses upon non-consenting others. In which of the following scenarios would solitary acts or those involving consenting others meet the criteria for diagnosis? A. If the individual would be embarrassed if their behavior was discovered. B. If the behavior is potentially dangerous. C. If the individual performs the acts outside of a private space. D. If the individual is very concerned about their partner rejecting them due to their behavior. E. If the individual takes on the role of another person as part of the behavior. There is a category under paraphilic disorders which can be used if an individual's solitary acts or those with consenting others are associated with thoughts, fantasies, urges or behavior which are very distressing but not as a consequence of rejection or feared rejection of the arousal pattern by others, or confer direct risk of injury or death. So this is the category under paraphilic disorders that can be used. Question number 8. The answer is B, if the behavior is potentially dangerous. Question number 9. Malingering is the falsification or exaggeration of illness, either physical or mental, for the purpose of secondary gain. Under which diagnostic grouping is it placed in ICD-11? A. Factitious disorders. B. Personality disorders. C. Factors influencing health status or contact with health services. D. Disruptive behavior and dissocial disorders. E. Impulse control disorders. Malingering is not categorized as a mental health condition under ICD-11. It is mentioned under factors influencing health status or contact with health services. It should be accurately recorded when it is part of an individual's presentation. The answer for question number 9 is C. Malingering is placed under factors influencing health status or contact with health services in ICD-11. Question number 10. Which of the following is a new disorder in ICD-11 under the obsessive compulsive and related disorders grouping? A. Olfactory reference disorder. B. Avoidant or restrictive food intake disorder. C. Body integrity dysphoria. D. Bodily distress disorder. E. Gaming disorder. Olfactory reference disorder is a new diagnosis under obsessive compulsive and related disorders. It is characterized by the persistent belief one is emitting an offensive body odor or breath which is either unnoticeable or only slightly noticeable to others. Individuals experience excessive self-consciousness about the perceived odor, often with ideas of reference. The individual perform repeated and excessive behaviors such as checking for the odor, seeking reassurance, trying to eliminate or cover up the smell, and avoiding social situations. All these are features of olfactory reference disorder. Bodily distress disorder and body integrity dysphoria are grouped under disorders of bodily distress and bodily experience. Bodily distress disorder involves persistent bodily sensations that are distressing to the individual. Avoidant or restrictive food intake disorder is categorized under feeding and eating disorders and replaces feeding disorder of infancy or childhood. It refers to individuals who engage in abnormal behavior around eating, not motivated by cognitions around body image, which leads to inadequate intake. The answer for question number 10 is option A. Olfactory reference disorder is a new disorder in ICD-11 under the obsessive compulsive and related disorders grouping. Question number 11. Which of the following is a qualifier, an additional diagnostic descriptor for depressive episodes in ICD-11? A. Suicidal ideation. B. Melancholic features. C. Acute onset. D. Severe disturbance of functioning. E. Catatonia. In terms of ICD-11 dimensional revision of diagnosis, the qualifiers include melancholic features, anxiety symptoms, panic attacks, and seasonal pattern. In terms of severity, they are graded into mild, moderate, and severe. For moderate and severe episodes, we have to indicate if there are psychotic symptoms. Catatonia is not one of the qualifiers. Catatonia is contained within its own diagnostic grouping. The answer for question number 11 is B. Melancholic features is a qualifier, an additional diagnostic descriptor for depressive episodes in ICD-11. Question number 12. In ICD-11, which of the following diagnosis is still recognized in the schizophrenia and primary psychotic disorders diagnostic grouping? A. Hebephrenic schizophrenia. B. Paranoid schizophrenia. C. Schizoaffective disorder. D. Residual schizophrenia. E. Simple schizophrenia. In ICD-11, the schizophrenia subtypes are eliminated. Dimensional descriptors are used instead to provide information about the nature of a patient's symptoms. Schizoaffective disorder continues to be recognized in ICD-11. The answer for question number 12 is C. Schizoaffective disorder is still recognized in the schizophrenia and primary psychotic disorders diagnostic grouping. Question number 13. Body integrity dysphoria is a new inclusion in ICD-11. Which of the following is characteristic of this new disorder? A. The desire to have a specific disability. B. The feeling that a body part is not truly part of one's body. C. The sense that one's body is not functioning correctly. D. The feeling that a certain body part is not under one's control. E. The sense that one's body is not real. Body integrity dysphoria is characterized by the intense and persistent desire to have a particular disability and to feel discomforted by not having this disability. It's usually thought to have onset during childhood or early adolescence. The desire to become physically disabled results in harmful consequences as manifested by either preoccupation with the desire significantly interfering with productivity, with leisure activities, or with social functioning, or by attempts to actually become disabled, resulting in the person putting their health or life in significant jeopardy. Question number 13. The answer is option A. The desire to have a specific disability is a characteristic feature of body integrity dysphoria, which is a new inclusion in ICD-11. Question number 14. Which of the following diagnostic groupings include selective mutism in ICD-11? A. Neurodevelopmental disorders. B. Obsessive compulsive and related disorders. C. Disorders specifically associated with stress. D. Dissociative disorders. And E. Anxiety and fear related disorders. Anxiety and fear related disorders includes selective mutism and separation anxiety. Selective mutism is characterized by consistent selectivity in speaking, the child demonstrates adequate language competence in specific social situations, typically at home, but consistently fails to speak in others. And it is of sufficient severity to interfere with educational achievement or with social communication. Question number 14. The correct answer is E. Anxiety and fear related disorders includes selective mutism in ICD-11. Question number 15. Which of the following disorders is included in the new diagnostic grouping of disorders of bodily distress and bodily experience in ICD-11? A. Body dysmorphic disorder. B. Excoriation disorder. C. Hypochondriasis. D. Trichotillomania. E. Body integrity dysphoria. Disorders of bodily distress and bodily experience. Disorders in this grouping are characterized by disturbance in the person's experience of their body. This includes bodily distress disorder and body integrity dysphoria. Bodily distress disorder in ICD-11 broadly replaces somatoform disorders and neurasthenia. Question number 15. The correct answer is option E. Body integrity dysphoria is a disorder which is included in the new diagnostic grouping of disorders of bodily distress and bodily experience in ICD-11. The other diagnoses lie within the obsessive compulsive and related disorders, with trichotillomania and excoriation disorder being within the body focused repetitive behavior disorders subgrouping. Question number 16. Which of the following is a qualifier, an additional diagnostic descriptor that can be used for disorders under the obsessive compulsive and related disorders grouping? A. Prominent checking behaviors. B. Without obsessive ideation. C. Without compulsive behaviors. D. Poor to absent insight. E. Treatment resistant. Under ICD-11 obsessive compulsive disorders, in terms of specifiers, we have patients with fair to good insight and we have patients with poor to absent insight. With fair to good insight, much of the time the individual is able to entertain the possibility that their beliefs may not be true and that they are willing to accept an alternative explanation for obsessions and compulsions. With poor to absent insight, most or all of the time, the individual is convinced that their beliefs are true and that they cannot accept an alternative explanation for their experience. The poor to absent insight qualifier can be used when an individual's obsessive cognitions are so intense as to be almost delusional in nature, but they are consistent with the existing obsessive compulsive or related disorder diagnosis. Question number 16. The answer is D. Poor to absent insight is a qualifier, an additional diagnostic descriptor that can be used for disorders under the obsessive compulsive and related disorders grouping. Question number 17. Which of the following is a qualifier for the diagnosis under the disruptive and dissocial disorders grouping? A. Criminal behavior. B. Limited prosocial emotions. C. Emotional lability. D. Childhood versus adult onset. E. Self-injury. Disruptive behavior or dissocial disorders. Disorders in this grouping are characterized by persistent behavioral problems that range from markedly and persistently deviant, disobedient, provocative, or spiteful to those that violate the basic rights of others or major societal norms, rules, or laws. Onset is commonly during childhood, though not always. Problems often persist into adulthood. The following specifiers may be applied to all disorders in this grouping with limited prosocial emotions with typical prosocial emotions. The disruptive and dissocial disorders diagnostic grouping includes oppositional defiant disorder and conduct disorder. they can both receive a qualifier of limited prosocial emotions that indicates a poorer long-term prognosis. Oppositional defiant disorder can receive a qualifier of with chronic irritability and anger, while conduct disorder can receive a qualifier of childhood versus adolescent onset. The answer for question number 17 is B. Limited prosocial emotions is a qualifier for the diagnosis under the disruptive and dissocial disorders grouping.